think Anjana madam, we can start. Sirup sir, what do you say?
Yes, ma'am, we can start it.
Yes, ma'am.
So good evening to one and all joined for this enthusiastic debate that has been organized by the team IAME. On behalf of the team IAME, I would like to invite all the participants, the moderator, as well as the eminent speakers for today's debate. We are going to have a debate on the topic elective posting in India, whether it is an innovation or challenge. We have with us two teams who will be debating on this topic. And with no further ado, I would like to invite our EC member, Dr. T.S.R. Anjana ma'am, who is the professor and head Department of Anatomy from Government Tiruvannamalai Medical College, to kindly introduce the moderator and speakers for today's session. Over to you, ma'am.
Good evening, one and all. This is Dr. Anjana, Professor and HOD of Anatomy from Government Tiruvannamalai Medical College, Tamil Nadu, and also EC member of IAME. On behalf of Team IAME, I take immense pleasure in welcoming you all to this insightful debate on elective postings in India, innovation or challenge. So firstly, I would like to welcome our President, Dr. Pragnesh Palmer, sir, Vice President, Dr. Ghulam Muhammad Bhatt, sir, and Founder and General Secretary, Dr. Kribakaran, sir, whose brainchild is this debate topic. And moving on to the introduction of our speakers, the moderator for the session is Professor Dr. Neelam Patil, who is a Professor of Biochemistry at T.N.M.C and B.Y.L Nair Medical College Hospital, Mumbai, Maharashtra. And she's a FAMA fellow and has also completed advanced course in medical education. And she also holds a PhD degree from the Maharashtra University of Health Sciences. To her credit, she holds various administrative positions like Treasurer, Faculty of Medical Education Unit, EC member at IAME again, and she's also an associate editor at MedPulse International Journal of Biochemistry. And she's also part of the editorial team at the International Journal of Medical Sciences and Academic Research. She's also the INEBL internal auditor for medical laboratories, and also part of the Six Sigma Black Belt for Laboratories, Government of India. To her credit, she has 25 publications and has also one book to her credit with 2 copyrights. And her areas of interest include total laboratory management, metabolomics, medical education, and research methodologies. So next slide.
Just a small correction, ma'am. I'm yet to get the degree PhD. I'm still doing.
Oh, fine, ma'am. Nice, ma'am. Nice to know, ma'am. Thank you.
Thanks.
And from the team Innovation, we have Professor Dr. Chandralekha, ma'am. She's also the HOD of Pharmacology at Father Muller Medical College, Mangalore. She's also a FAMA fellow from Mahib, Manipal. And apart from that, heading her department, she is the Adverse Drug Reaction Monitoring Center coordinator at her institution and a member of various committees like Mangala Ethics Committee. And she's also part of MEU and Internal Quality Assurance Cell and Pharmacotherapeutic Committee. Apart from being a active member of various committees, she has also conducted quizzes at national level. And under her leadership, her institution has secured 9th position in the countrywide ADR monitoring center among the 700 plus centers for 2 consecutive years. We welcome you, ma'am. And next in team challenge, we have our own Dr. Kavitha madam, who is currently the dean at Government Kilpauk Medical College, Chennai, and she's also a professor of microbiology. And she has been associated with the medical education since 2011 and has also served as a convener at T.N.M.C Regional Center, Madras Medical College for the past 4 years. Apart from that, she has held various administrative positions like Vice Principal, MCI Nodal Officer, and Nodal Officer for Biomedical Waste Management, and Regional Center for Nodal Center for HIV Research at Stanley Medical College, and has been part of the Ethics Committee. And apart from that, she has received District Collector Best Medical Officer Award in the year 2014 and Independence Day Award in 2024. To her adding to the crown as the Best Medical Teaching Award from our state government in the year 2024, the category of Medical Education Unit. Madam has always been an active member and she has been a speaker at various CMEs and conferences, and she herself has organized various workshops, training almost most faculties at Madras Medical College. Welcome you, Madam.
Thank you, Anjana.
Thank you. And again, in team innovation, it's my turn to invite Dr. Neeraj Mahajan, sir, who is a professor of physiology with over at NHL Municipal Medical College, Ahmedabad, Gujarat, with over 25 years of teaching experience. He is also a FAMA fellow from GSMC Mumbai and has completed advanced course in medical education from CMC Ludhiana. Now, sir heads the T.N.M.C Nodal Center for Faculty Development Program at his own institute, and he's the convener there. To his credit, he has over 50 publications and 3 books in his name. From the technology front, he owns a YouTube channel and a highest rated physiology mobile app, which is used globally in about 50 countries. And he also has a few AA module designs as part of his FAMA fellowship program. We welcome you, sir. Next slide.
Thank you and welcome.
And again, from Team Challenge, we have Dr. Sampada Tambolkar, ma'am, who is a professor in pediatrics at Dr. D.Y. Patil Medical College, Pune, Maharashtra. She's again a FAMA fellow. And adding testament to her interest in medical education, she has completed PhD in medical education and currently pursuing MHP at Maastricht University, Netherlands. She's an avid gold medalist and has keen interest in medical education. She's now a part of curriculum committee at her institution and board of studies at the D.Y. Patil University. She actually has co-authored a book on electives in India. And with over 35 publications in both national and international journals, she is part of various associations like Association of Adolescent and Child Care. And she has played an important role in vaccine trials from the prestigious WHO for bivalent oral polio vaccine. Now, she is also a resource person for the MUHS degree plus program and has been awarded Best Teacher Award by the D.Y. Patil University. We welcome you, madam, to the event. So with that, note, I welcome each and every one of you to this interesting debate. Hope you all take a lot of insights from this debate from the erudite speakers here. Thank you. Thank you for joining us. Thank you.
Can I request Dr. Leena, madam, please let us know
to
all
all.
of this debate?
Yeah. So it is already given, the topic itself explained, but I want to emphasize few things which should be the goal of what we have to take out of it, and we want solutions for those things are just we want to travel through the journey of all minds. It's not like we are pro or we are against anything. It is like we travel through the journey of all minds, what confusions they have, and we have to come on to one single point. So that is first thing is to make clear to everyone why elective postings are important. Then how students will acquire new skills and what new learnings they will have, and what clarity of mind they will have from their postings, electives, while we are separately keeping the electives. What is the goal of electives? We want to make them learn, not just the teachers, the students also should know why they want to have electives. Then third thing is how these electives will lead them into developing confidence and professionalism. And then we should have find out more ways to have electives better, because I have circulated one Google form on behalf of IAME. 47 responses we got, and in that around 15 were it is not useful. Both teachers and they were not useful, or they were neutral about it. They were not knowing. And the main challenges they were saying was in that Google sheet analysis. What we found is they are like there is no proper format, there is no proper guidance from the teacher. Teacher are changing, and something system is lacking still. The modules which are being made are just superficially made. So like that they have committed. So from this debate, we want to come on to those challenges and what we can further do and how they can help to build a medical training more stronger. So that is the goal. And I think our moderator will be able to do a rigorous discussion, and impartial and non-biased discussion will be there. And over to you for further proceedings. Thank you so much.
Sure, madam. Thank you, Dr. Anjana, madam, for that warm introduction. And thank you, Dr. Leela, madam, for setting the stage so beautifully well. So, good evening, everyone. I'm Dr. Neelam Patil, and it is my privilege to serve as the moderator for today's debate. And the debate, rather than debate, let us understand it as a dialogue on elective postings in Indian medical education, innovation or challenge. Before we start, I'll be reading just one or two lines from the N.M.C elective document. What N.M.C says that electives are learning experiences that will provide the learner with an opportunity to gain immersive experience of a career stream, discipline, or research project. Now, the opportunity to work in a clinical, laboratory, research, community setup, or in a team-based setting at an early stage in the profession is an invaluable experience for learners, as this will have lasting impact on the professional life. N.M.C also says that an elective allows students to think of a career beyond examinations and gives them an impetus to think laterally besides laying down the foundation for future professional pathways. It also allows students to match their aspirations with the ground reality in a field of their choice. Now, as Madam said, let us have this debate to explore both the promises as well as the practical hurdles of elective postings in our medical curriculum in total. Now, this concept, let us see whether it encourages flexibility, choice, or as N.M.C says, various innovation. But let us also see if it brings with it several implementation concerns, or it brings any equitable, it should be equitable everywhere across all medical colleges. So concern for that also. So for today, we have two insightful teams with us today. Now each of the team will be bringing a unique perspective on electives based on their experiences and based on the evidence that they have implemented electives at their own institute. Now, team innovation, we have Dr. Chandralekha madam and Dr. Neeraj Mahajan sir. Team challenges, we have Dr. Kavitha Muthusamy madam and Dr. Sampada madam. Each team will be presenting their case, which will be followed by the rebuttals, any cross-questioning, and then a moderated discussion. The audience will also have a chance to share their questions, or they can post their questions in the chat box, and all the questions will be taken towards the end. So we begin with round one with the 4 arguments, where each team will have 10 minutes to establish their 4 arguments. So to begin with, I invite team innovation, how elective can enrich learning through autonomy and various diverse experiences. So team innovation, Dr. Chandralekha madam.
Yeah, thank you,
Yes.
ma'am, for the warm introduction and welcome. So it's so nice to see you all with all the stalwarts here. So talking about the topic, the innovation, so electives, when CBME came, this electives was a new terminology for our medical curriculum. We have heard about this about in the other parts of the country. So electives, what are the significance of that? So when this came, so in our, I can talk about our institute. So each from each department when it was circulated. So there was a faculty development program. So everyone came up with the topic, and it was a developed. It was a teamwork where MEU team led this activity and teamwork. Well planned. It was ahead of elective, the students coming for electives. So with this topic, the student got a lot of options. So with the counseling, they were given a lot of options. They were given the choice which one they want to take. They took that topic. So I did have to have chance to interact with many of the students. So what they told is, so they had immersive learnings. They took interest. Many of them. So there were some kind of students who were not involved from the both the sides. It's not just one side. It's both the sides. But majority of them did say they immersively they were involved in all the activities, whatever was given to them. They finished their task, and at the end, so they did have a self-directed learning. It was not just what you say the task given like this. So they were involved in the critical thinking, decision making, clinical application, including the knowledge as well as the skills, plus going to the bedside, or where I can talk about my departments where we gave them about pharmacovigilance or the prescription rational prescribe, where they did go to the bedside, where they did see the interactions, where they did see the prescription for the rationality about the adverse drug reaction. It was not just recent, just I finished my pharmacovigilance electives, where they actively went and searched for the areas. So when they see for the areas, it was not just the area they see for. So they did see what was the area, the lab value abnormality areas. Is there any possibility other than drug? And why was there a mechanism for the area? So what was the it is, you cannot just there are textbook references, but there are some areas we had to go and check for the literature. When they went and checked back the literature, that literature search also was a learning for them. So this was the feedback which I got. So literature search, how structured the case report was. And this is just a pharmacology example I'm giving. So I can talk about all the preclinical subjects. The anatomy, there was dissection of joints. So it was like a reminding them or reinforcing them. It is not just you become all one day you become a surgeon. So importance of anatomy, it is not just a theory subject. So biochemistry, they did learn about the interpretation of a lot of clinical parameters. So what is normal, what is abnormal, inborn errors. So the clinical application part. So physiology, clinical examination, that is more important. So whatever field you take, unless you know what is normal, you'll not be able to appreciate abnormal. So significance of physiology subject. So you come to microbiology, interpretation of culture. Culture sensitivity. So I know a lot of clinicians, they call microbiology. Once the report comes, how to interpret? There are some 5-6 drug reasons, which one to give. So this interpretation. So in pathology, there was nephropathology, oncopathology. So where the students did the slides, they did staining. So they did interpretation of that. So it was a kind of learning experience to them. And talking about the clinical side, and most about the research methodology. So as a part of research, there was a mock ethics committee meeting also, where the students got to learn how the ethics committee functions, how was the presentation, how the committee members asked the question, what were the queries, when they were told to get back about the queries. And each one of these students were given the checklist about what was discussed, what was happening. So what all this were, or this address, or this or any address given, whether will you approve or not. So all these things, they had hands-on immersive experience. Talking about the clinical part, there are a lot of clinical, each department had their own topics, multiple topics as well. They're stressing on the golden hour of trauma, and talking about the emergency handling, the triaging, and emergency in radiology, cancer, infertility, unexplained infertility. There is the topic as garbhagudi. So where they had the first hand experience. So when I talk, and one of the students did come and tell me he had one of the surgical posting, I don't know what it was. He told me that was a new thing to me, which I don't think which I would have also appreciated. He saw a new junior staff finishing surgery very quickly than an experienced senior surgeon. And he even also noticed that what extra technique or that fine skills he noticed. So what was that? So this noticing, not just the theory, not just the skills knowledge. So they did look for the what was happening, the background, the reality check in each specialty. So okay, this is the background. It's not just one man show. There's a teamwork happening behind that. There are the nurses, technicians, there are other workers, the IR workers. Everyone's role also was appreciated. What happened before, what happened later. And in one of the diabetic food posting, patient had this endocrinology posting also, diabetic food posting also. So there was one patient, chronic patient. When these students were posted, there was regular dressing happening. and these people also were part of that dressing, and they know at the end of the posting that patient discharged with a big smile on his face. So that was so satisfying for them. So it is like, it is not just one part. So the other way thinking, outside their curriculum, they're getting to do hands on there. They know what they say. So they would have not thought of that way in the classroom. They would have not paid attention. It was small, guru, small. It was the number of students were 2 to 5. So the attention was more. So they when we gave the attention, so the, what you say, their what is that, acceptance and their work, everything was happening there. So it was, even though it was a full day, it was not tight jam packed, it was flexible based on our availability. On the days which were free, we would call them on that hour and give them. So they were also happy. So they also got some 1 or 2 hours free hours, so they could do their some other works also. So it was a mutual kind of thing. So we also taught them, they also learned from us, and there was clinical work happening also. So that was, so that was satisfying for me also. So where we made them understand, it is not just the clinical MBBS, and the medical care is not just about the clinical subject. So there are preclinical subjects where the significance of that. So based on that, what is normal, what is dissection, what goes behind the prescription, so what goes behind the lab parameters, and everything, they understood the significance. And there was some dissemination also, not just that, there was some coffee tea chats also, ice cream chats also. So that was also kind of bond development. So I think I have said enough from my experience.
Yeah, that was the points were very well, wonderfully put up, madam. When you say that there were a lot of learning experiences, right?
Yes.
So maybe in my view, when these students they come back, it's just a learning circle. From the first year anatomy, physiology, and biochemistry, they have a hand of all these subjects, and maybe in the second year pharmacology, microbiology, pathology, so they can correlate all the basic sciences very well. So
Yes,
very
yes.
well put up, madam. Congratulations for that.
Thank you, ma'am.
Uh,
Thank you.
Dr. Neeraj Mahajan, sir.
Sir, you are muted.
Sir, please unmute yourself.
Okay, I am starting from where Dr. Chandralekha has left. So she explained the immersive experience the students are having, the holistic ones. Now, I want to draw attention towards how we can compare any other part of MBBS with this innovative elective part. That is quite different, and it's sort of a welcome change. Look, in a very long span of MBBS, we are not having any part which is basically career based, where we ever mention that students' career and interest is important. Here we are mentioning it. And we all know that it is one of the most important thing. Career is important thing. Student choice is never a point in any part of MBBS. They are having set competencies. They have to undergo a robust examinations and clear it. Now, here, as Dr. Neelam also said in the N.M.C document, robust assessment is not needed. They will come and observe. So critical thinking or vision will develop under no extraordinary pressure, which is normally not there in any part of MBBS. And they will start thinking that, yes, this is my real interest. This is my that. And in addition to that, the N.M.C has also kept one part in the pre and para. Now, in the pre and para, majority of the students are having very less idea about these branches. As a career, they come, they study, they pass. But what goes in the life of a teacher, that is very less known to the students. So that part also is important. Because it is innovative, I have tried to derive few special things, which I think is missing from any other part of MBBS curriculum from the word itself. If we take the elective word, the first 3 words are ELE. That is experiential learning. They will not have any pressure and they will experience, like we go in a match and we really enjoy the match, experience the match. So elective can be like that. If we take the next 2 words, it is CT, elective, critical thinking. When they are not having pressure,
they will have a critical thinking about the field, holistic point of view, and that will be holistic point of view. Otherwise, always and always their focus is examination. They can't think beyond examination as far as MBBS is concerned. It is too hard to cover even the basic curriculum. Even topper can't say that I have covered the curriculum, left the other normal students. If we take the next word, it is I, interest. So it is the only part where we are talking about interest of the student. No other part. Possibly we are not able to give a elective to number one interest, but at least we are talking about students' interest here. At least they will know if they are not in a elective that is their first choice, they can still come to know through their friends. If we take the next two words, it is V and E. They will develop the vision and they will evolve, because this is how the person evolve, when he observe without any pressure. And electives, if we say S, it is a real student-centric activity. So these are the things I observed, and I will say that it is something the student go beyond or US or UK and always says that their system is better, they are having a flexibility, they can change the things anywhere. So at least something flexible has entered into our UG curriculum, and that is something to welcome. Teething troubles are there, implementation challenges are there, but then with time we will overcome it, and our students will shine and get benefit out of it. Thank you.
Very, very wonderfully put up, Neeraj sir. I mean, the first time I'm looking at the what you say electives as a short form, where you told E is experiential learning, CT will be critical thinking. Yes, many of them do not think about this word I, which is interest generation in the students, as well as vision and evolving. And lastly, because it is a student-centric activity. Yes, you have also put up, sir, that this is as per the choice of the students, right? And we should also think about the career of the students. So yes, electives is a wholesome, what you say, experiential learning program. Uh, so that was very, very wonderfully put up, team innovation. Thank you for that inspiring start. Can I now invite team challenges to present their perspective? Let us now see the real world issues that come with the elective course. I invite Dr. Kavitha Muthusamy, madam, for the same.
Am I audible?
Yes, ma'am.
This one.
Yes. Good evening. Thank you all. Nice to be a part of this. From my perspective, for the past 4 years, we have been handling these electives, and this is the 5th year. And actually, what we have seen is there is a mixture of things. Actually, many of the few of the students have found it very interesting, and they have found what they can do. But I would like to approach this in as a preparedness. How prepared are we with regards to the student, the teacher, and the administrator? 3 persons play a very important role here. The administrator, in what way are they important? In what way is this being misused, or it is not managed in a proper way? Is first allotment of electives. The name electives say it has to originate from the student, and they can choose the electives. But in many of the colleges, from what I have heard, they say that they just divide the students into 8 groups and send them to each department, and it's just yet another class of microbiology or biochemistry, and it is not the way that they look at that as a career. And most of the electives, I should say pre and para electives, most of the students don't see it as a career based exposure, but it's more useful for them to understand the subject. So the administrator first, they should permit the students to choose their own elective first thing. In that process, we have one challenge is there are many students going towards one elective. Like previously, madam was saying 2 to 3 students or 3 to 5 students only were there in one elective. Now, when say in a college which has 250 students, there would be only a possibility of having some 12 electives in pre and paramedical. At that time, what happens is they have to be accommodated only within this. Maybe they may be divided into two groups, but still, I say it is a challenge to fix them into smaller groups. Sometimes we have 80 students choosing the same elective for various reasons. It may be one, it can be peer group is going towards it. The other, maybe they leave them early at at 2 o'clock or something like that. And so that interest in students, again, are they prepared to learn by themselves? Always we have been giving them some exam to achieve something in life and to come and perform and get marks. How far are the students prepared to come, learn for themselves, know what they want? I can say in a proportion, only 20 students, percentage of the students may be able to do it on their own, unless we prime them. And is that priming being done? And one more thing is with the teachers, I can say there's a gross difference between those who have undergone a training like BCME and then ACME. Their performance as a teacher is much, much more better than somebody who has not done that, or their orientation towards making this really good for the students is not there. So the preparedness of the teacher is very, very important to hold the students into that. The subsequent year, the student chooses an elective where the teacher has shown a great interest and guided them throughout the session. Like what happens is, since the whole day is left to them, it's a great opportunity to learn fully that whole thing. And they can do as Sir said, the experiential learning can happen. They can also do the student doctor learning method, like following the patient from admission to discharge in a very nice manner. But what we see there in reality is most of the time, say 50% of the time, we see that it is not being utilized to the full actually. So I would like that the administrators really give us the freedom to make them choose the elective, and the decision making of the student, I can say, it's very sad. Like I have been as vice principal, I have witnessed so many students get out of a postgraduate by paying 40 lakhs of rupees. The value of the money, the value of what they want to become, they're not able to do. So I always tell when I choose an elective, this is something like that. Though it is a career based and you can know, but decision making of what is what. I can say somebody has become an ophthalmologist, never wanted to look to the microscope and do surgery, so they could not cope up with that. And a person who did dermatology wanted to use a steth and he could not use it. So he did not want. So this kind of exposure, are we giving it really to the student for them to decide the career based on their exposure to electives? So I would like the teacher's role as well as the student's role and the administrative's role. Three should be there so that we equally distribute. Students are given an opportunity. We should find much more electives so that they are in more smaller groups, and give them an opportunity so that they can have a maximum use of it. So this is my side. Thank you.
Very nicely put up, madam, and that comes with experience. Madam has wonderfully put up some points like administrator preparedness. 2 points that madam has stressed upon is the preparedness of the learner, whether they are really prepared to learn by themselves. And number two, preparedness of the teacher. Very well put up, because not all of the teachers, they are all trained in the faculty development programs. Some of them are not trained. So implementing electives in a structured manner all over the medical colleges, yes, it comes with certain challenges. I would now like to invite Dr. Sampada madam from the team challenges to kindly put up her point of view.
Well, thank you, Dr. Neelam, and thank you, the IAME, for giving me these opportunities alongside the stalwarts. So I'm the match finisher, let's say. And to start with, let's say, change is the only constant that we say. And unfortunately, in medical education, change is the only constant with a lot of confusion. So every change is going to bring in a lot of confusion, and this confusion adds to misery. No, well, this is not exactly misery, but let's just kind of break it down. So let's just first understand that CBME curriculum was started in 2019, as we all know. And the pillars of CBME curriculum that we have been taught is that one is self-directed learning, second, electives, third, ECs, early clinical exposure, fourth is formative assessments, and fifth is integrated teaching. So these are the 5 pillars of thing, out of which today we're going to talk about electives. Much has been said before, its pros and cons, but when these electives were started, doing a master's program that time, and it's like, yay, finally we've been there. So it was kind of, yes, now there's freedom, there is excitement, there is choice, and so on and so forth. It's like, and there was like a wow. And then suddenly it's like, okay, step back. It's been 4 years now, like ma'am said. Take a deep breath, analyze what you've done. You've done your program, and now it's time for your program evaluation. And in the program evaluation, let's start with what the challenges are. We say we have 4 pillars of democracy. Here, in the medical curriculum or in medical education or health professional education, we have 5 pillars there. The first pillar, of course, is the students. The second pillar, the faculty. The third pillar is the organization and the infrastructure. The fourth pillar is, of course, the administration that brings in about these changes. And the fifth pillar, which I feel, though is a part of the curriculum, is the assessments. And, of course, the governing bodies. So let's talk about each. Now, we are all faculty sitting here, so let's not point fingers at the students first. Let's start with the faculty first. What about shortage of faculty? We have 808 medical colleges which are sanctioned by the N.M.C. with a 1,23,700 seats, out of which 56,000 seats have been added in the last 5 years. And mind you, this is after COVID. Now, do we have this faculty, like Kavitha ma'am already said, faculty which is A, available, and B, trained? Now, this is a paper which has come up in medical teacher in 2022, saying that it's not an Indian paper, but it's about the Indian medical graduates, that 60% of Indian medical colleges do not have trained faculty, which is a fact. Like ma'am said, is that if you don't have trained faculty, you don't have a structured program because you are just not taught. For example, now there is a rule come up, it's like, okay, a diploma holder can also be a faculty. A person with 10 years experience in medical clinical practice can also be a faculty. You ask any doctor who's passed about 10 years back and ask him, what is CBME? So the answer is, ye CBME kya hai, ye CBME? We just don't know what is CBME. And to tell them, okay, there is an electives in the CBME and you have to have a structured format, is too much. Like, chhod do. Hum apne yahan theek hai. That is the general agenda that is given by them. So, yeah. So one thing is, if you do not have structured faculty, if you do not have a structured program, there is no alignment. You don't know what is going on, what is going to be taught. Well, yes, then they say that, okay, there are some institute with excellent teachers, great, with great infrastructure, excellent, fine, then what else? So you have somebody who is learning in IVF, is going to the cath labs, is going to the infertility clinics, excellent, but the problem is that how much is it for the Instagram page or the Instagram reel that they are making? And how much is the competencies that they have achieved? That's something which is a point of reflection for all of us as medical educators. Because Professor Van Vleuten, who was one of my teachers at Maastricht, and he is the father of programmatic assessment and a proponent of self-directed learning. And he said, Sampada, self-directed learning needs more direction than normal traditional learning. Now, these are words of wisdom. Do we have the capability to provide them structured self-directed learning? A. Then somebody came and said, oh, wow, we've got freedom to choose. Freedom. Freedom. Nowadays, everybody talks of freedom, freedom of expression, freedom of one, freedom of whatever. Now, remember one thing, that freedom without structure can bring in utter chaos in learning. So that is a takeaway from this. We have a 2023 review in the BMC Medical Education done by our very own Bhatia, Dr. Bhatia, Tejinder Singh, etc., which says that electives, if they are unmonitored, leads to no learning. Now, this is a published paper in 2023. Fine. So we've taken the blame. Okay, faculty, done. We know what are the problems. What about the infrastructure? Infrastructure inequity. Now remember, the basis of any medical curriculum the world over is EDI. It is first equity, diversity, inclusion. And I'm sure the makers of electives have thought about it and have included it with the criteria that, okay, it's going to be equity and inclusion. But we have to understand that there is equity, there is equality and not equity. You'll ask me, what is the difference? The difference is if you have to go on a treading path, a difficult path, to give shoes to everyone is equality. But giving right size, fitting shoes, helpful for that path is equity. Are we really giving that equity to our students is something which we need to give. So you have two levels of schools in medical schools in India. You have something which is coming straight out of Karan Johar's Bollywood movies with hi-fi skills labs, with state-of-art infrastructure. And you have other schools which have a microscope as old as me. Is this equity? No, this is not equity. Now, then the students are going to crib and cry over inequality and justice. That is one thing that we really need to do. So you have one set of schools who are dishing out Michelin star gourmet dishes, and you have the other schools who are dishing out 2-minute noodle street food. I'm not saying it is bad, but it can be bad for health. So that is what is something which needs to be done about infrastructure inequity. Now, what happens is that with this, you have total loss of motivation because you have these sets of students connected by WhatsApp and social media to n number of colleges across the country, in fact, even abroad. And then they see, okay, aapne kya kiya? So someone has done and seen an open heart surgery, while someone is so demotivated that he himself is doing a broken heart surgery, albeit in his hostel room. So that's the level of inequity that we can see. Then comes what is that, to carry home that message, is that vision without resources is an illusion. Vision, I repeat, vision without resources is an illusion. And electives once meant to promote choice have ultimately now decided to promote envy. There is a lot of infights which happens on the choosing of electives. Like Kavitha ma'am said, there were 80 students wanting to go into cardiothoracic surgery or pediatric cardiology just because they like the teacher there. And all students cannot be accommodated in that elective. And that starts the fights with them. We've seen it, experienced it. So that's about it. Then what happens? The favorite thing of all teachers is attendance. I think all of us agree that the new normal is remedial. With this program, remember that electives were started abroad with a curriculum course of 6 years. So the undergraduate medical education abroad is of 6 years. Now cut it short to 4.5 years. We already have an overburdened curriculum with a Gantt chart with not a single day left for a remedial. Now, supposing this individual misses 3, 4, 5 days, or maybe he misses entire block because of, say, a correct reason of medical emergencies, where and when are you going to fit him for another remedial? Because the T.N.M.C says that if you do not do your electives, you will not be eligible. So now where is the scope of fitting in that extra? Okay, you fit that thing extra. What about the teachers who are already overburdened with a lot of curriculum to be handled? Will these teachers again go back and do the same electives again for 1 or 2 students? So that is one point which needs to be tested, that attendance. So these periods ultimately end up being labeled as free periods. And there is a risk of being labeled as free periods. And I don't know what we have to do anything about it. Okay. So then that is about the third most important problem. Next one, somebody came in the chat saying, what about assessments? Now, Dr. Neeraj sir rightfully said that, it was meant for not being assessed, etc. Sir, we all know the famous quote that assessment drives learning. So if you have somebody who, Peter Drucker, he famously once said that what gets measured gets managed. So if you do not have somebody assessing you, and that too with a
I think Madam has lost the connection.
Yes.
I think Madam has lost the connection. No worries. But Madam had put up wonderful points stating, we'll continue with Madam once she joins back. But yes, some of the important points that Madam had put up and really we face it for our day-to-day implementation of electives is the
I'm
point
sorry,
of
sorry.
attendance.
I think I
Yes.
just kind of, there was an internet problem, Dr. Neelam, sorry.
No problem. You can continue.
Yeah, so I was at the assessment part. So if you have students who are not being assessed, the student says simply, no marks, no sparks. We are just not worried about, okay. And other criteria is that we are talking, the heart and soul of a CBME curriculum is formative assessment and feedback. And if you do not incorporate these electives as a part of the formative assessment, the total exercise can go slapstick. This is extremely important to understand because now electives are only being served as a qualifier or as an eligibility criterion to appear for the final MBBS exam, period. Now, if there is no formative assessment tag, there are a fair number of students who may not take it seriously, will take it as a 15-day or a 1-month break. And are we debarring them? Are we giving them remedial? What are we doing with these students? So that is one important point of assessment that needs to be done. There is one paper which I have got, and that paper is by Dornan on 2020 medical education paper, which says that in the middle and low income group countries, poorly assessed electives show minimal or no impact on competencies. Now, this is a paper which has come in medical education, which is something which we really need to think of. And last but not the least, the administrative challenge, which I think Madam has already put forth. She's the dean herself. In a study which was published in the National Journal of Medical Education, a survey done which said that 70% of deans and head or of administration have agreed that they have serious challenges in implementing electives because of the difficulty in coordination and limited coordination capacity. So, we have electives being managed by 1 or 2 coordinators and some of the module operators. I just call them operators because they are actually delivering the electives. The rest of the faculty, staff, nobody actually knows what is going on. So choosing is a problem, delivering is a problem, and ultimately it should not be Excel exercise of 90% Excel sheets and 10% learning. So, it's Robin Sharma once famously said, if the change is very messy at first, it is bearable in between and beautiful at the end. So I think the elective journey has to be extremely beautiful. It is going to be beautiful. We are in the middle and we are going to end up with a beautiful journey. Thank you.
I must say that was very, very wonderfully put up, Madam.
Thank you.
I think everyone will agree. Some of the points, Madam, that has really stood up is when you said freedom without structure, right? So, yes. And also you have given us the 5 pillars like students, faculty, organization, administration, and you have really thrown light on what we all fear is assessment. very well articulated, madam, and the participant has also mentioned it. So after this, the words of wisdom from all our four panel members. Let us now move on to round two, which is rebuttals and cross-examination. So each team will be having 10 minutes to directly respond to each other's arguments. They can identify the gap of what was spoken earlier, and then they can reinforce their own stance. So let us start from the opposite team, that is team challenges first. And then we move on to team innovation. So team challenges, either Kavitha madam or Sampada madam.
I think Kavitha ma'am can go on first, then I can follow.
Yes, Kavitha madam can start. Yes, madam.
Yes, madam. The gaps that has to be addressed would be like we have to have some particular number of students, a maximum or minimum that can be put into some kind of a group. The number of electives can be fixed, and like I can say it is variable in different colleges, but which can be made into something like there are different ideas by different people. Like I can say, like though we have pharmacovigilance, some of them have animal studies in pharmacology itself, like, or it can be related to some system or something. It may not be only preclinical or paraclinical. It can be also having a component of clinical kind of thing, so that the systems can be addressed. What we would like to do is the choosing method. What we have seen is now when 70 or 80 people do, we have had different ideas like who has studied well in the previous exam, what marks have they got. So based on it, we will give them priority. But does that mean that a person who has not got good marks cannot do what he wants to do as an elective? That marks cannot be a base of this. Then we had another kind of random sampling coming across the way. But is that random sampling? We will be losing people who really want to do what they may be getting different things which they don't want to do also. Like, so how are we going to standardize which student will be selected for which program and what will be the basis for it? Like, can it be like we get some 5 choices and then how do we choose that this person will get this choice? If we come by alphabetical order also, then the person who has a name starting and last will not be getting it. So how do we fix this? Who will be getting what elective and whether they will be getting what they want when there are more in number? Like another way which this gap, what I have seen it across is, as madam, you read it out in the electives thing, you should give them some kind of communication skills, or you see we have knowledge, skill, attitude. Like we can have certain common components into each of the electives so that wherever they go, they may have a common thing. But only thing, say for communication skills, it can be either with a respiratory patient or with a neurology patient, but the communication is what they're going to learn. Like, so just I was just reading the message here. Actually, electivist students should be given the opportunity to choose what they want to take it as their own career, to explore whether that will be correct for them or not. But I can say that we have had so many challenges in giving them what they want and in choosing what they want. So this is one thing. The other thing is the teachers. I'd like to say, as madam said, the availability of teachers and whether they are trained or not. There is another problem of the teacher has to do how many things during that particular period of time of electives. So they have to look into their regular curriculum. They have to look into their any other deputed work. They have to go and come. How much are they able to follow the students from beginning to end? If many doctors have to look after a particular group of students. Are they all knowing what has happened before and what is continuing later? Say if I am in charge of the electives or I am the preceptor, I may be looking at them for 3 days. Then 2 days I may have an anti-ragging duty, I may have another duty or administrative something else. So during that time, who takes care of them and what are we able to work as a team to address that particular thing? Or do we prioritize electives in our work? When we have so many different types of work, are we able to prioritize this as the first one? So what happens to the student when we are not addressing them in full for the whole day? They lose interest and then it becomes like we are just captivating and holding them only for attendance and not for what all they want us to learn here. Like, so these things we see. I have also seen many departments who are very happy. They cut a cake at the end. They become very close. Many super specialty departments who have not been exposed to undergraduate education at all. They love them so much because they're so young. They've never seen young. All of them are old in their departments who come after family life or anything. So they're very enthusiastic. But the proportionate of what is happening like that and what is being considered as a torture also, I can say at times, both for the student as well as for the teacher, because they are not prepared for the journey together. Another one more point is, as madam said, the attendance calculated. How much are we putting it for 14 working days? Or is it put just for 2 weeks, of which 4 days may be holidays? So what is the exposure that we're giving to them? Is the time kept under thing? There is no particular hours or anything that can be done. So this attendance, are we really making them, denying them that they cannot write their exam? It's a sad no. It is just for completion's sake. Sometimes they just rush it up and complete it. Now, as madam said, it's a complete packed GNAT chart, which we cannot compromise. It's uniformity across the state, which keeps us, there are some local, some of the functions or anything where holidays happen in each of the places, which can also be a problem for the duration of electives for one group, and for another group, it may not be the same, similar like. So these are some of the things that we have still, we are just trying to gap fill whatever. So which remains unanswered. We have to work very hard towards it. Unless we do that, we will not be able to do justice. Definitely a portion of them are enjoying and are prepared, but there is still a long way to go to make it more wholesome.
Yes, madam, there's still a long way to go. But yes, we also face such problems in our institution, and I must say everyone present might be facing this. Number one is the attendance problem. So if our elective is for maybe 15 days and maybe 4 to 5 days continuous holidays come in, how do we go about that? So that is one question that can be answered. And number two is with the faculty, less of faculty or more of work, more of other roles that are being played by the faculties. Are there any prioritization of the elective programs? Are these programs being prioritized? And yes, if they are not priorities, definitely the student will lose interest. Uh, uh, Sampada madam, your take on this? You want to add to this?
All these points have been put forth by Kavitha ma'am so relevantly and so beautifully. I just wanted to give a quick insight, if that's okay. Since I'm the elective coordinator at my institute, ever since they were started, what we have done, like ma'am said, is that we ask each individual to give us 6 choices of their choices, and we have about 54 modules in the pre and para and 54 modules in the clinical also. And we have a batch strength of 250 students, which we divide between the two. So we end up not having many of them. We allow approximately 6 to 8 students in one group. So that's a manageable lot for a small group teaching. So if then they give their own order and preference, and then at the start of their second MBBS only, we tell them that your second MBBS marks are going to define what electives you are going to get. And from their seniors, they have come to know that what electives are. And, they have already started thinking, okay, which teacher do I want to go to? So that's an added advantage that, they start actually preparing for their second MBBS. So that's actually how it has worked in my institute, of course, to each their own. And giving them 6 choices also ends up being that they get an elective preferably of their own choice. Only about 2 or 3 students might want a shift, which is possible because I have kept spare lots empty where there are no takers. I've kept them as on a back burner. If a student needs to go into their slot, they are welcome. So that means that point of equality, equity is something kind of sorted. At least my way, that's what I feel. I may be wrong. Second thing is, I think we all are from different medical education backgrounds. If we can share our repositories of electives with each other, or the NMC has a common repository where you can just bounce back on each other's electives. Some beautifully taken, the one which I saw, one at AIMS Nagpur. They start off with cell culture in anatomy, and they end up going to the IVF and seeing and actually extracting the ovum. So they follow the entire journey. So such kind of repository sharing amongst institutes can actually help us with the problem of uniformity, because then the teachers will get ready-made modules. Those of who are experienced teachers, very good teachers, but may not be knowing the nuances of structured learning. So I think that may help us, or we can help each other structure their learning. So that's one. And I think if on a central level, if we get assessment rubrics, now like Dr. Neeraj said, is that we do not want marks or we do not want formal assessments, but we definitely want to know how they felt about it. So if you give them a standardized format of reflections and that's taken as a QA thing, a quality analysis thing, the problem of assessment, I think, can be dealt with if you have standardized reflections, and counting these reflections into a formative assessment and making it compulsory that, okay, you will be graded. And then these grades will be taken into, of course, that would be a much higher level decision. But it would be my earnest appeal to the National Medical Commission that do something about the uniformity. So that's, I think, what also I think. And Dr. Neeraj has put the word elective so beautifully. Thank you, Dr. Neeraj. I was not aware of this. But to counter your first electives, then the challenges I have come with a new run is elective. So eliminate learning, casual training, and increasing variability and enmity. That is also an elective. So now which way you want to, I'm certainly very, very happy that Neeraj sir has come up with it, and we certainly would want our students to go Neeraj sir's way. So thank you, Dr. Neelam. I think this is what I wanted to add.
I think for the audience, it's a feast of knowledge. Everyone will agree. Different takes on electives, and wonderfully put up, madam. One was the repository sharing. Yes, that's a very good idea. And number 2 is the reflection should be standardized. Like one more thing is maybe I may put it as an advantage or a challenge is distributing electives based on the marks. So that is again a food for thought. I invite the other team, that is Team Innovation, to give a take or to put forth their views. Dr. Chandralekha, would you want to go first?
Yeah, so Dr. Kavitha ma'am and Dr. Sampada ma'am, the very well the points where it came from all the experienced, it came from heartfelt experiences when you're in that leadership position. So my take is that, as Kavitha madam and Sampada ma'am also told regarding the taking up of electives, so based on marks, I'm pro for that. Why? Because even our NEET ranking, what is that, UG, PG seat, everything is based on the ranking, which is again a mark system. So based on, in our institute also, the whatever the seat allotment is based on the second year marks. So, and we, as I said, we were well prepared, well in advance, where there was a faculty development program where a lesson plan template was shared, and there were torchbearers from each department, one or two people. They went back and shared the lesson plan. Each department has like, at least I can talk for prepare, we had 28 modules, elective modules, and from the clinical side there is about 50 plus modules. So these are the modules. So there was a lesson plan. There was not just one preceptor. So there was another preceptor also who could take over. And in specialties where there were PGs also were taking over the activities wherever required. And what I saw in my institute was a department program. It did not fit. Even though one faculty took up a leadership of that one activity, it was a kind of department activity. And this circulars from the dean, it was sent well in advance. It was not just 1 week. So the electives posting what we had, it was sent well in advance, 2 months, that students are coming from this date, and so the students are coming, be ready. And the allotment, as I said, we had a faculty developed program. So we had to do a USP flyer also, unique selling points. What was our unique selling points of each electives? What activities we did? What was it? I can talk about what flyer I did about the pharmacovigilance. So what I highlighted about the adverse drug reaction, I did highlight about the corporate job, Monday to Friday job with the corporate salary, where you will be leading a 5-star life. So that was really attractive. I did get a few students asking about that. How is it possible working for a 5 days of being a doctor? Yes, in the industry field, you get to work for 5 days and 2 days off, which is not the usual one. So that was the different part, but I could add that point also. No, it was not just the curriculum teaching or the adverse drug reaction. So that was also one of the point. What are the activities? So each elective there was a module, there was an attractive title, and all electives had a USP where students, it was circulated to all the students what was covered in each, who was the preceptor, which department was taking what. So everything they got to know well in advance. And so the selection was based on marks. Yes, so students did have a choices from the pre-para side. When I talk about the pre-para topics, like first year and second year topics, they did have a clinical application part also. So and the about this, so when we, as I said, in my from my department, we had 5 electives. So we had pharmacovigilance, meteorovigilance, we had animal handling also, but this year we could not take because that faculty was handling this had left the institute. Then we had antimicrobial stewardship program, antimicrobial audit as a part of that, prescription audit, and emergency drugs. So with emergency drugs, the faculty had taken the students for the crash cart experience. What are the drugs, in which drug, what is this stored? They were taken to ICU also. What are the drugs given? How it is being calculated? The dose is being calculated. How it is administered? So with the prescription audit also, they did live prescription audit. They did check for the rationality. They did check for duplication of drug. They did check for drug interactions. So there was communication. So there's all the hands-on experiences also. I was talking about the physiological part. So physical examination, general physical examination. So there was the normal as well as the bedside also, the physical examination. So, and regarding the seats, I said ma'am was telling about the 80 students opting for that. So when I said that this needs a structure program, so when you make a lesson plan, you also decide how many seats you're giving. So there is a clarity. So this topic has 4 seats. It will be 4 seats. 80 students cannot take that. So based on the rank, as the seats get filled, they get to know they have to take the next option, whatever is available. So when I said we have 28 modules in the first and second year subjects, including research. So the seats were varied from 3 to 5. Only research had 10 seats each. So there were 4 modules from the research side, had 10 seats each. In my department, we had 25 seats, where 5 modules and 25 seats. So this was it. And from anatomy, there were 3 modules. From physiology, there were 2 modules. And biochemistry, there were some 3-4 modules, which had 6 seats each. So the seats, we have 150 intake. So whatever the modules we had, then the seats were planned. So it was adequate for our 150 intake. And as I said, in my institute, nowhere I felt any student complaining about what they got. So they maybe I am biased, but few students did say, ma'am, what I got on just I finished my pharmacovigilance elective, so I gave ice cream treat to my students, and the other student who finished the other, that group came and told, ma'am, this happened only in pharmacology, we did not get ice cream. So that is the only one complaint I heard this time. They did not get the ice cream. And that's what I said. No, we did develop a bond. The last signature part. So when it was the signature signing part, so today also the students were coming to take signature from my department, other electives. So so they also they were sharing their experiences, what they learned. So I was also asking something, how did it go? So it was kind of not just electives. They even learned the communication, empathy, professionalism, the body language, non-verbal communication. So they know now what is this. It is not just passing first and second year subject. They know now. They just finished the block 1 posting, so they know it is more than the passing subject. So restricting, as madam highlighted, so be having a structured lesson plan, structured activity, outcome you want from that. You can plan on this assessment. I think we have that round later. Maybe I can limit topic now. So the assessment part, how you do the well planning and doing a USP. So we have a coordinator through MEU that was circulated to all the students, and advanced planning. So that is what the strength of my institute I can tell about. So it is advanced planning, so advanced intimation that students are coming. So this is how it worked in my institute here.
Thank you, ma'am. So
Thank you.
maybe next time one of the criteria that we keep for elective selection is which department or which elective is giving us ice creams. Jokes apart, Madam has touched one important point that NMC also tells us, that a counseling session with the faculty members is very, very important. This point we might have lost when we implement electives with limited resource faculties. And what NMC says is that students must also be made aware of the rules regarding the attendance, the work schedule, documentation, assessment requirements for each elective. That also prior. And one more point that Madam mentioned is the institutions will predetermine the number and the nature of electives. So thank you, Madam, for your take. Over to Dr. Neeraj.
Well, because of, I think, immense experience, both Dr. Kavitha and Dr. Sampada has put so many points. So I am taking their point itself. In fact, some of the points are already answered in the second round by Dr. Sampada, what should be done. So anyway, the first faculty shortage point has been raised, but if we see how many students are doing, not just in the clinical branches, also in the pre and paraclinical branches, PG, at this point of time, we are sure that things will be different in coming few years. I will just give an example from Ahmedabad, where I am working. Patan is supposed to be a sort of remote area. When I go for a workshop, of course, the point was faculty is less. When I went a year after, the administrator themselves were saying is that we are having almost all faculty filled. So this is going to be solved in near future, or we are in the way. Second point that has been mentioned is that FDP, Faculty Development Program, plays a big role, trained faculty versus untrained faculty. So NMC is giving a quite a emphasis on faculty development program. And this interest is also coming on behalf of teacher also. If we see how many teachers are applying for advanced course, how many teachers trying to become FEMER fellow, number is quite a bit, all are not being addressed. So faculty also want to be trained. It's not that they are totally not interested, or and some, if 1% is not interested, what can be done? I mean, they might not be teaching their subject well also. So that percentage may exist here and there. It does exist in each and every branch. So administrator point has been raised. So if you see now, dean is made part of curriculum committee, part of MEU unit, and they have made compulsory to get administrator trained as well. So these all are the efforts that has been happening so that more and more faculty get trained and get involved. Now, second point that has been mentioned is that if things are not unmonitored or unassessed, then there will be no learning of competencies. Now, really, we are purpose of elective is learning few competencies, or it is a exposure, keeping their interest and career in mind. Can we say that only when we have monitored, we have learned anything or we could observe anything? In fact, holistic observation happens when there is no robust or too, you can say, immense assessment. Then and then we are able to observe holistically. Here we are talking about their career in particular branch. So if we go little relaxed, in fact, if I recall the elective session, online elective session by Dr. Krishna Shishadri, who played quite a role in developing the module, he mentioned during his talk many a times that take it easy, go relax, let them observe. So even if it is little, say, relaxed atmosphere, just they are there, even if the teacher shared their experience, I mean, majority of those who will come in the pre-para possibly will become faculty in the medical colleges. So if the faculty share their experience, this we are doing in our department. When the students are coming in our department for elective posting, we select senior teacher, we select mid teacher, we select junior teacher. And teacher, they share their experience as a teacher, ups and downs. And students come to know, they get so engaged and involved that it is something to watch. So all these experiences can be given and student can benefit out of it. Diversity point has been raised. I mean, took any branch, we are having some cities, some institute which are of international level. We are having some area in the country which are just joining the stream. So we should be happy that at least something is being started there. What is happening in the biggest medical college, NMC is trying that should happen in the most remote college as well. Of course, they will not match, but we are happy that they are part of the team. They will learn from the bigger institute. So this is the way anything develops. So diversity, we can welcome it that we are even, I just went to Northeast. Now every 8 of the state of Northeast are having a medical colleges, and all the faculties were quite interested to know about all these things, how they can do better. So in spite of the fact that diversity exists, they are joining the team, and they will also be come up with time. Some point have already been raised that there should be more number of choices. If I give the example, Bhavnagar Medical College takes 9 choices from the student, and there is a basis. On that basis, either 1 or 2 or 3rd student are usually getting, and they give the reason why you have not get the first choice and you are getting subsequent choices. Number of elective also, as Sampada madam said, their institute is having about 54 modules or something like that. In Bhavnagar, they are having more than 100 modules. So we can learn from each other and we can come up with more and more modules that will also address some of the problems. So these are the points which are coming in my mind. And I am sure that it is, I mean, we can't say that if I talk to any student, a majority of the students says that the idea is good, but implementation is a bit shaky. So it is up to our hand. Kavitha madam also said is that 20% or 30% students are very satisfied. So we are here, we should increase this 20 or 30% to 40% next year, to 50% next year. This is how the things will happen. And like in the knowledge domain or skill domain, we are having the best doctors considering anywhere in the world. I am sure that down the line in 4 or 5 years, we are having the best elective papers also and some best outcomes of elective as well. That is definitely going to happen. But this teething period, of course, we should improve by all means possible.
That was very optimistic, Dr. Neeraj. And yes, experience sharing is a must. Okay. We now move on to the question and answer round, the audience interactions. There were few questions that were put up in the chat box. Number 1 was, how much time is given for the students to choose their electives? Is any guidance given, and how is the objectives of the electives given to the students? Madam, sirs, your experience, please. Someone wants to answer this?
It's actually, it is 2 weeks, as all of them know, like 2 weeks for pre and para, and 2 weeks for clinical. How do we choose the objectives? It is the creativity of the teachers, I should say. They can do it, and as Madam had said, 54 electives in their college, Dr. Sampada had said, and similarly, 100 sir had said in one of the colleges. So it is for us to be creative
Bhavnagar.
to create the objectives of each elective. Yes, others also can put.
Dr. Neelam, can
And
I add?
Yes, madam.
Just to share, we have 54 and 54, 108.
yes,
Very,
both
very
54,
quite an auspicious
54
number.
in both
That's why I restricted at 54 and 54.
54, both
Superstitions
categories.
apart.
Block 1 and
But
block 2.
yeah, so what we generally do is that before they between their first and third second, after they finish their last practical exam, that's when we do a combined counseling for the entire batch, where all these modules are shared with them online through the LMS. So all these modules are structured where every module has a title, their objectives mentioned, how they are going to be assessed, who is the preceptor of that module, and what they are expected to get to learn and all is shared with them. And that's how, in a matter of weeks' time, they give their choices to us. The choices are communicated to us through the LMS, and that's how we have the team which from the UG section giving us their rankings from their second MBBS marks, and that's how we do the allotment on the Excel sheet. So we give
And
about a week's time for them to think about the modules. The modules are displayed to them much before the counseling session.
yes, that is the NMC guideline also, that before allotting the electives, well ahead of time, these should be announced so that they can think over it.
Yeah, so 2 weeks time is ideal, I feel, which is followed in our institute also, and it is done well in advance, even before third year exams. Also, do not wait till the exam gets. So as soon as they finish the exams, the electives will start.
Yes,
Ma'am
but
has
the fear,
highlighted
the
objectives
fear,
and outcomes. Everything has to be highlighted
True, true.
with the
There's one more
department.
question in the chat box. In a newly established medical college, is it important to conduct a faculty development program on electives before actually starting? I think we have already discussed this, but the question is in a newly established medical college.
this is not only in a new medical college, even in an already existing medical college, I can say like, we have around 54 departments like in Madras Medical College where we had done this electives. In all the 54 departments, we make them give whatever their choices are for electives. 1 or 2 departments may have more than one or just one also like. So we have to, like I'm just reading through this. We have found that in some there are no takers also like, but they are not understanding that they can have a good experience also like. So the peer group also plays a very important role in deciding which electives they would like to go also like.
And faculty development program, in fact, BCME is a compulsory training from AP onwards. So even in the new medical colleges, immediately the CC committee member and MU committee member, they get trained in the nodal or regional center, and very soon the FDP happens in their institute as well.
Actually, CISP is more teaching about this
Yes.
elective than the
CISP
BCME.
also at least
So
30%. The route is
It's
same.
not
yes, electives is handled there with the
Yes, yes.
experience sharing of the students.
electives.
And we have seen many of the super specialists who now only they are coming, like say for example, in our college we had 1,000 faculty. So to conduct a program for 1,000 faculty, however frequently I do, it took me 3 years to complete for all of them. So we had to include all of them. So, but before the electives, we did really call all of them, the preceptors and the HODs, because without the administration of the HOD, we cannot go to the preceptor who may be an assistant professor. We gave them training for all the faculties and HODs, the HODs of all the departments, as well as the preceptors. And as you all said, postgraduates also are involved in this. Without postgraduates, this will not be a success. We also made some 4 programs for the postgraduates as well for them to understand. So many of the postgraduates were telling, oh, in our days, we did not have such thing. How fortunate the youngsters now are. They are teaching them in this manner. Like most of the postgraduates gave us that feedback. Like, but it is important that they also learn that, because we were into the first two batches now. Postgraduates also had to be playing a role, and we had to introduce them to BCME and what it is, and now what it is to be done with electives. Because one thing we noticed was the mentoring of them was more successful than of a senior faculty, especially with these students, and more so with electives. Like, so they did really play a very great role in, modeling them towards this as a career path.
Yes, yes. Thank you, madam. We can just take one or maximum two questions because of the lack of time. I think Dr. Swapnil Paralikar had raised his hand. Dr. Swapnil, you wanted to ask something?
Yes, madam.
Yes, sir.
Actually, it is a comment that as Lawrence Stenhouse, I read Harden a lot, and as Lawrence Stenhouse pointed out that there is no such thing as curricular development without faculty development. So we should have robust faculty development so that the faculty are passionate and at least oriented towards the strategies for teaching so that it is implemented in a proper way. Because the challenges, every challenge is an opportunity. The challenges are plenty, but as Dr. Neeraj Mahajan says, that we will reach there. Like we never made good single malt whiskey, but now we have probably made the makers of the best single malt whiskey in the world. So maybe we will have the best elective ecology also at some point of time.
Definitely,
True that.
definitely.
True that. SP has raised hand. This is the last question that we can take. SP. SP wants to say or ask something.
Muted.
Okay. Anyone else? We can take one question, then we'll move on to the closing statements. Anyone else wants to ask? That was a really very insightful session and insightful debate. Okay. We now come to our final round, which is the closing statements. I would okay, one question. I can take one more. Who has raised their hands? Apart from Dr. Swapnil, anyone else? Okay. So we come now to our final round, which are the closing statements. Each team, I can give you 1 minute to summarize your key arguments and offer a concluding thought on the impact and the future direction of the elective postings in India. So, Team Innovation, your final remarks, please.
So talking about the assessment, so NMC can take a lead and create a portal, an online portal where they can ask institute to display the elective modules and how many number of students have taken with their roll numbers, and after once it is done, they can upload from the institution side, upload the completion of that. So with the meets expectations, so whatever the assessment they have taken, it could be the MCQ, the presentation, or a viva, or a abstract writing from the research article, or the application of skills or the knowledge whatever they've applied, so as a meets expectation or exceeds the expectation, so that can be taken by NMC as for giving credit points, which can be displayed in the NMC portal. So that is one. And I stress on the faculty development program with the lesson plan development for electives. That is what I feel which is most important. So we need not wait till the CISP or a BCME or ACME or FEMA. So how to develop a lesson plan with the objectives, what are the teaching learning methodologies, what are the activities you have planned, so a breakdown day by day or week by week, and assessment method, what is planned and how you plan to evaluate that program, evaluation, feedback, and resources required. Everything can be worked out, including the logistics, one preceptor, two preceptor, including PGs. Everything can be jotted down in that lesson plan, including the requirement of digital tools. Everything has to be jotted down in that lesson plan and plan according. So even if that preceptor is not there, someone else from the department can take up that electives.
Okay. Team challenges, your closing statement.
Yes. Uh, I would like to say the assessment as what Dr. Chandralekha said. I'd like to add that portfolio is a very good assessment method, which the student will be enjoying to, it will be a joy for them to look back at it even at a later date if they have joined that particular course in the as a career and if they've chosen it as a career also. So portfolio is one of the very interesting thing which a student can do and look back to it. So in spite of all the challenges, we have lived a life as doctors, and now with the demanding, expanding growth of the medical fraternity and the demand is never less. Always it's been increasing, and we have been coping up with everything. I like to take this COVID-19 as an example where we have risen to the occasion, and we will definitely do it with a handful of torch bearers. We would definitely achieve more greater thing, but we have to be keeping on talking about it. And it was very nice to know that all of them have so many electives. A repository of that will definitely help us to lead the country itself on electives. Thank you.
Thank you to both the teams for their rich and very well balanced perspectives on electives. And thank you to our audience for your engagement and thoughtful questions. And both sides, they represented an exciting opportunity and a complex challenge as well. And I won't call it a debate, though it was a debate, it was a dialogue to help us move one step further to find this balance on electives. I now hand over to Dr. Vidyasagar for the vote of thanks.
Thank you, Dr. Neelam. Hello?
Yes, sir, you're audible.
Yeah, thank you. Thank you, Dr. Neelam. It was a nice and pleasant meeting with very good, important discussion. And I thank Dr. Kavitha Madam, Dr. Chandralekha, Dr. Neeraj, and Dr. Sampada. Sorry, sorry, Dr. Sampada. It was a really good discussion. And I thank the IAME to give us this facility to discuss every month. And I wish these discussions go on for every month, and then we bring out good, important decisions in this, and then communicate these decisions to the concerned authorities so that these things are implemented very well. And I thank the president of our association, General Secretary, and Treasurer of the association. Thank you, one and all the audience. Thank you so much.
And with this, I declare our panel, our debate as completed. Thank you. Thank you all.
Thank you.
Thank you.
Thank you so much.
Thank you.
Thank you.